Women and men differ in the type of heart failure that they get. So men are more likely to get a type of heart failure in which the heart muscle as a pump tends to be impaired, whereas women are more likely to be affected by a type of heart failure that affects the stiffness of the heart muscle. And it's important to note that treatments for heart failure are very effective in the type of heart failure that men are more likely to get, whereas the type of heart failure that women are more likely to get, even now in 2018, treatment targets for this type of disease are limited and have shown not significant improvement with respect to outcomes.
We did a population-based study that took place in Ontario over a 5-year span. So we included all ambulatory patients, so that's patients who are walking around in the community, who were newly diagnosed with heart failure between 2009 and 2014. So we found that the death rates within a year after heart failure has dropped in both sexes, but the drop was a little less in women compared to men. So in other words, the rates of death a year after heart failure diagnosis remained higher in women. So that was the number one key finding. The second key finding was that the risk of hospitalizations went down in men, but went up in women.
So heart failure is actually a very common condition. It's a disease where the heart is unable to meet the needs of the body. It can be caused by a number of different things. One of the most common causes of heart failure is a heart attack. Heart failure increases in prevalence as we get older, and in fact it's the number one reason why patients over the age of 65 are admitted to hospitals here in Ontario. There is a very important gender discrepancy. Women have not been enjoying the same reduction in mortality as men with respect to a new heart failure diagnosis, and as Dr. Sun has suggested, the rates of hospitalization for heart failure for women are actually increasing, suggesting that this disease continues to be a substantial implicator in their morbidity and their mortality. So some of the work that Dr. Sun and I are doing will help to address some of these questions in future studies.